the med students put this conference on, and they had like 400 healthcare professionals show up. And then Young, the med student, came to the US, did residency in Southern California, and did GI fellowship at Mayo Clinic, and then went back to Southern California and just sort of started that all over again in the US. So that's a little bit about the organization I work with and where I came from. And about 4 years ago, I started thinking and realizing as I was interacting with healthcare professionals and healthcare students and doing spiritual care in the clinical setting, I realized that probably the number one challenge and the number one obstacle was time. I am on record, and I will tell anybody, that I think the idea of a 15-minute visit with a patient is absurd. It's an insult, and as one of my board members told me, a nurse whose brother is a physician, father is a physician, sister is a physician. She said, we're not letting doctors be scientists anymore. And so there are all types of problems in healthcare. And so I've given the better part of my adult life to working with people like you. But how do we navigate this time issue? And I got on the phone and I got on Zoom and I started reaching out to some physicians, mostly, that I've connected with over the years. Most of them had attended our summer whole person care preceptorship in Southern California. And I was pretty sure that they were doing spiritual care with their patients. And this was primary care physicians, this was specialists, this was surgeons. And I got them on the phone, or I had lunch with them, and I said, are you doing spiritual care? And they're like, heck yeah. And I said, how are you managing that with the ever-increasing time constraints? And they were like, ugh. But I said, well, you're doing it. And they said, yeah. And I said, well, how? And had fascinating conversations. And so this is an easy talk for me because all I'm going to do is tell you what they told me. And hopefully some of this will be useful to you as you seek to integrate your Christian faith into your patient care and care for the spiritual needs of your patients. I'd like to thank you for the work that you're doing, for the population that you're working with. I assume since you're here is CCHF. You are working with, for the most part, the least of these. And I coach family medicine residents in a major faith-based FQHC that is caring for underserved patients. And I see firsthand what you see. And I'm not a physician, so I don't understand all the things that are going on, but I see the challenges that you guys have to deal with day in and day out, and the disappointments and the frustration and the lack of resources that you might feel, the lack of resources that your patients maybe have. So thank you for the work that you're doing. It is hugely significant. And students, thank you for the work that you're putting in right now. And the delayed gratification as you go home at Christmas and you get together with your undergrad friends and they're making money and you're still paying money. And thank you. And study hard, because if I look up from a gurney one day and see your smiling face, I want to know that you hopefully you learned a thing or two. And so thanks for the work that you're doing. And maybe as you're here at CCHF and rubbing shoulders with the other people in this room, you'll get a better idea of maybe how God could use you in a pretty exciting way. So let me pray as we start out. Father, thank you for the men and women in this room, for the sacrifices that they make to care for men and women and children that you created, that are made in your image, that are worthy of dignity and are worthy of care. And thank you for the way that these men and women are standing in the gap to provide that care. And I pray that they would represent you well. And I pray that today, as we spend a few minutes together, be able to share something that would help them be more effective, help them to lean more into the call that you have on their lives. And as one of my friends we'll talk about said, be able to do the medical care more efficiently so I can get to what's really important, most important, and that's the spiritual care. And so I pray you'd bless us, and I pray today and from last night and tomorrow that this would be an incredibly refreshing season and time. And I pray relationships would form that would be bonds that could serve as buoyancy and connection and encouragement for years to come. And I pray all this in your son's name. Amen. So let me see. Well, that's not working. It was working a minute ago. Bummer. Do it the old-fashioned way. Whoops. All right. This is Alicia. I met Alicia the summer before she started medical school at Harvard. And she came to our whole person care preceptorship. Alicia is a family practice physician in Houston, Texas. Anybody from Texas? Yeah. Oh, God, you whoop people. Okay. You didn't have to do that. But Alicia is working in Houston. I got her on the phone and I said, "Are you doing spiritual care?" And she said, "Yes." And I said, "How are you managing time constraints?" And she said, "Ugh." And she told me, she said, "Okay, give you an idea. I have 15-minute appointments with established patients and 30-minute appointments with new or annual patients." And she said, "With every one of my patients, I do a spiritual history. And it takes me 60 to 90 seconds to do that spiritual history." And so she moves pretty fast. Spiritual history is a series of questions that are designed to find out what is a patient's coping system. Is faith a part of that coping system? Are there spiritual needs there? Does a patient recognize those needs? Do they want to have those needs addressed? And do they give permission? And so I actually did a session on that yesterday. I've done that session here before. If you want to get a review or a primer, you can go online right now and find a previous session, or you can wait a few weeks and maybe I'll have the one from yesterday up. But here are some of the questions that Alicia asked. She'll ask them about their support system. Do they have a good support system? She will ask them about their work, their school, if they're retired, their past job, occupation, or what are their current job or activities. She will ask them about their goals in general. What's important to you? What are you hoping to accomplish in the coming weeks or the coming year? And she said, "Bob, that will often really begin to open up what's going on with them." She will ask them about their coping skills, and more specifically, are they from a particular faith background, or she might say, is faith meaningful to you? And then she will say, well, what does that look like for you? And then she will always, at the end of the visit, she will ask a patient, she will say, would it be helpful if I pray for you? Now, Alicia's family practice, and so she has, she has pediatric patients as well. She'll do spiritual history on the kids. And those questions are, tell me about your living situation. What grade are you in? What clubs, activities are you involved in? Tell me a little bit about your friends, the proverbial, what do you want to do when you grow up? And she'll ask them about their faith background, if they attend church, are part of a religion, and she'll offer prayer to her kids as well. Great thing about family medicine is a lot of times you have continuity. And so often she will chart what she finds out, and that might be a basis for ongoing conversation in the future. Let me see here. Now, in your training, I just talked about in your training, you are asked, or you are trained the 50 questions to ask about hypertension, or 25, or however many questions there are. So who just did their OSCE? Somebody told me they just did an OSCE. Yeah, and so I'm not going to ask you what those questions are, but in your training and as you get into practice, you see on the chart, or the MA comes out and tells you that they're in for maybe high blood pressure, or their blood pressure was high. And you do not go in and ask them the 50 questions on hypertension. Is that right? No, you don't do that. You begin to focus in on the 1 or 2 questions that you feel will be most relevant. And my med student friends tell me one of the things that they're always wanting to do is they're wanting to find the high yield stuff, the high yield question. And so as I train residents, I will ask them before they go in the room, based on what they see in the chart and what they have found out from the MA, what are 1 or 2 high potential, high yield spiritual history questions that you want to ask? Because you don't have time to ask 50 hypertension questions, but you will figure out the 1 or 2 that you want to do. And I think in taking a spiritual history, that might be incredibly practical. What are the relevant potential high yield 1 or 2 questions that I can ask? This is Ben. I met Ben after he had finished his first year of med school at University of Indiana. He too came to our summer whole person care preceptorship. And these are some of the things that Ben told me. I realize you might not be able to read all of this, but he told me, he said, Bob, as I drive to work every day, I will try to invite God into my day, and I will try to follow his lead. I will let the Holy Spirit show me. I will let the Holy Spirit speak to me. I will try to be responsive to the Holy Spirit. And he said, you know, it's amazing because the days that I do that, it seems like those are the days that God brings people across my path. And he said, now it's easier to do spiritual care with a team. And so one of the things that he will do in his clinic, and at the time, Ben was working in a FQHC, faith-based, underserved, like many of you. And he said, it's really cool when our team is working on this together. He said, often we will pray as a team at the beginning of the day. He said, I actually have an MA who is really dialed in to doing spiritual care, and she will ask spiritual history questions. And when she comes out, a lot of times she'll already have some type of spiritual diagnosis, and she will tell me, you need to go in and you need to talk with them and make sure you mention this or you ask them about this. Ben told me that same thing. He doesn't ask 5, 6 spiritual history questions. He asks 1 or 2. And a lot of times, as he does that, again, family medicine, continuity, sees them again, he says it's hard not to keep a conversation going from one visit to the next. He said, my returning patients, he said, they will actually expect me to pray with them. They will expect me to ask about their faith or how I'm doing with it. He said he will chart the things that they mention when he asks spiritual history questions, because he's noticed it can actually be disappointing or even hurtful to his patients when they don't remember. Now, I know you're not going to be able to remember that, and he knows that too, and so that's why he charts. You know, if you know, a lot of times you can't even remember who the patient is. So those were some of the things. Let me see. I appreciated Ben when we talked because he said he was honest and he was real. He said, some days I just don't have time to do it. He said, I get behind and I can't do it. So he acknowledged the challenge, and he acknowledged that it's not necessarily every day, or certainly not every patient, but he tries to have that pattern of making it a priority. He says, sometimes I just triage, but other times, if it's urgent on a spiritual level, he said, I'll just take the time and deal with it. This is Bruce. I met Bruce summer before he started med school at Johns Hopkins. He too attended our whole person care preceptorship in Southern California. And Bruce is now a pulmonologist at MD Anderson Cancer Center. As you Texans know, 2025, MD Anderson was rated the #1 cancer center in the world. And Bruce talked about how he realized that, sometimes Jesus got up early and he stayed late. And he said, I need to have that attitude as I take care of my patients. He will ask them spiritual history questions. He will try to feel out if they have a spiritual need. He might even make a small comment to one of his patients about, I'm going to pray for you. I'm going to try to pray for you on an ongoing basis or something. He told me, he said, Bob, as he did spiritual care, he said one of his patients made an appointment to come in and see him simply so that the patient could talk with their pulmonologist at MD Anderson about faith and about their relationship with God. So you see, this is something that is important to patients and something that patients appreciate. Let me see. He said, I not only want to focus on those who don't know Jesus, but I also want to be willing to listen and minister to those who do know Jesus. I know that it is, you get busy and you're sprinting through your day and you're trying to keep up and you're trying to stay focused and everything. And it can be really, really hard to stay focused on doing spiritual care. And so I think we always need to be asking ourselves, what would Jesus do in this situation? And this is John Shin. I met John during his first year of med school at Loma Linda University, and John attended our summer preceptorship. After he finished med school, he did a internal medicine residency and hem-onc fellowship at the Mayo Clinic. From there, he went and did a stint at NIH, and then he is back in Southern California at Loma Linda. He is an oncologist. And I had lunch with John, and I said, John, are you doing spiritual care? And he said, yeah. And I said, how are you managing to do that with the ever-increasing time constraints? And he said, you need to understand a couple of things. He said, I am in academic medicine. And so at his institution in academic medicine, standard appointment is 30 minutes. So you guys are thinking, oh my goodness, what a luxury. And then I think on new patients or maybe annual patients, he actually gets 60 minutes. So nice little chunk of time. Now that sort of goes back to another principle of living out your faith and everything. And that is like thinking through in advance, what type of practice setting do you want to be in? And, of course, there are a lot of downsides about being in academic medicine, but challenges, but one of the upsides, 30-minute visits. And so, but I said, okay, well, that's nice. And I said, but what are some of the things that you do that help you to be able to do spiritual care? And this is going to blow some of you away. And I am not saying you have to do this. But John said, he said, well, Bob, he said, before I go in the room to see my patients, I've made all of my medical decisions. I'm up on their labs. I'm up on their meds. I have reviewed their chart. I have decided what course we're going to go. I've decided what adjustments in the meds we're going to have to do, treatments, whatever. All of that decided before I go into the room. And he's the one who said, because I want to be able to get to the important stuff, which is spiritual care. Now, this is a Mayo-trained oncologist that told me that. And I said, okay, well, John, how are you able to manage that? He said, well, I pre-round, obviously, on every one of my patients. Pre-round in the sense, in the chart. And I said, well, how long does that take you? He said, well, every day, hour, hour and a half, 2 hours. I'm like, every day? And he's like, yeah. And that's when he told me, because I want to get to the important stuff. And then he said, but you know what? He said, a lot of times I make it up throughout my day. My appointments actually end up being shorter, even with the spiritual care. He said, God just opens things up, enables me. And so I was like, wow. But you know, it made so much sense. And you and I have been talking about AI. And one of the things I am most excited about AI for you guys, let it do your charting, you know? And instead of, okay, Mr. Mark, Dr. Mark, good to see you. So what brought you in today? Huh? Yeah, and so tell me about, yeah, check. Oh, where is that box? You know, AI maybe will free you up a little bit more of that. And then maybe also AI will create a little extra 4 or 5 minutes in your visit. And if you don't have AI, I was with a resident just about a year ago. And I was in the room with her as she is seeing the patient. And I so appreciated her because instead of this, she had her computer positioned like this. And she was actually had developed the skill and the keyboard awareness. So tell me more, Mr. Mark, and what's going on, and how long has that been happening? When I took typing in high school, you're like, you took what? Yeah, you're not in your head. That's how they trained us. They didn't want us doing this. They said, no, you need to look at this tech and you need to learn the keyboard so that you can do this. So if you're stuck on the keyboard, you can maybe develop that skill. As I said, I've been doing this for a long time. And I've trained people who are now training others. And I was talking to Dr. Amy Hayton, one of the associate deans at the med school at Loma Linda. And Amy learned as a med student how to do spiritual care, and she's transforming the whole curriculum at Loma Linda to include spiritual care training throughout. And Amy and I were talking about what's the key? What determines who includes spiritual care and who does spiritual care? And I think these principles and these tips are really important. But she told me, and I absolutely agree, is intentionality. That's what makes a difference. An intentional commitment that I am going to include spiritual care. Now, a lot of times it's like, well, we're people of science. We don't have time to do that. In my presentation yesterday, I just unpacked a lot of information, peer-reviewed information that shows that when you do spiritual care, outcomes improve. When you do spiritual care, patient satisfaction goes through the roof in a positive way. When you do spiritual care, In some situations, the cost of healthcare goes down. And there was a CEO that was in my session yesterday, and I knew he was tracking with me, and I looked at him, and I'm like, what more do you want? As a metric as to whether to include spiritual care. So we're not talking about bringing something in that's irrelevant, that doesn't have any clinical relevance. I think it has significant clinical relevance. But yes.
Some docs may or may not be as comfortable as others.
Yes.
Doing spiritual care. And being in family medicine, if I'm not good at anything, it's referring out people.
Okay.
What's the role? Have you seen a model where you have a chaplain that you tag team with, clinically in an outpatient setting? Is that as effective, or is it, what are the pluses and minuses?
That's a great question. And I think the biggest thing is, are you and the chaplain on the same page?
Yeah.
And I think it is important. Now, a lot of times, many of you are maybe working in a faith-based clinic, and you might have a chaplain, and I'm assuming they're probably on the same page. That's not always the case in a major medical center. And I have, for years, encouraged clinicians, students, get to know the chaplain. If you're working in a hospital or even in a clinic, get to know the chaplain, understand their perspective on doing spiritual care, understand the theological framework that they're going to be coming from. And if there's alignment and agreement, then maybe you can refer. And so I think I think that's the number one thing you need to think through. The other thing that you need to think through, or you need to realize that as clinicians, you're the ones who have the relationship with the patient. You're the ones who are probably going to be the gateway for that to most effectively happen. If you refer, you're the one who can very naturally and relevantly bring that up. Chaplains they have incredible potential, and there's some really good chaplains out there, but they're sort of coming in a lot of times on the side, and they don't have that relationship. So those are some of the things that you think about. The thing that I always caution, don't just think they're going to take care of that and they're the best ones to do it. I think you're the best ones to do it, especially initially. So, but back to this thing of intentionality. Intentionality is huge. And I see that being the difference between those who do and those who don't. Well, how does intentionality work? This is Sarah. I met Sarah after her first year of medical school at the University of Nebraska. She attended our whole person care preceptorship summer program. And I caught up with Sarah and I said, Sarah, are you doing spiritual care? We talked on the phone. She said, yes, which I wasn't surprised at. And I said, how are you managing time constraints? She was like, But she told me several things, but this is what I want to focus on. She said, every day when I drive to work, I pray this prayer. God, help me to see what you want me to see. Oh, Sarah is a vascular surgeon. Okay, so she's moving pretty fast throughout her day. She said, help me to see what you want me to see, hear what you want me to hear, do what you want me to do. Okay, now that's a good prayer. And I'm not a vascular surgeon, but I could have come up with that prayer. But I don't know if you can read this, but here's the back end of it. Help me to see what you want me to see, do, say. Even when it's hard. Even when I don't want to. Even when it's scary. What do you hear there? Intentionality. Do you hear that? Every day when I go to work. And then she blew me away. She said, and I pray that prayer, Bob, several times throughout my day. You hear the intentionality? tips, techniques are important. But if you're intentional, I'm convinced God will help you figure it out. But I think intentionality is really, really key. This is Henry. Henry and his couple of partners have a sports medicine clinic in Southern California. And Henry attended our preceptorship, and I knew he was doing spiritual care because every summer, one of the things that we do is we have students go out and shadow clinicians who do spiritual care, variety of settings, variety of specialties. And Henry's one of the guys that we send students to. And I said, well, Henry, how are you managing with the time constraints? And again, I realize everybody doesn't have this luxury or this opportunity. But Henry, or maybe you do, maybe you could facilitate this. You know what Henry told me? No, you don't know. He said, well, we just don't schedule as many patients. Wow. Because we want to have time to be able to do spiritual care. Now, I get it. You might not have that control. But when Henry said that, and I said, well, Henry, what I hear you saying is that is why you're in healthcare. He said, dang right. And so he has made choices. And there's some choices and some ramifications that come from that. They don't make as much money. And they're in private practice, small group practice. There are a lot of times I wish I could grab administrators, I don't care what clinic they're in, and just sort of shake them. And it's like, what are you thinking? Why do we have to see that many? And I'm going out on a limb here, and I'm probably never going to they're never going to let me back in. But, and this wasn't in my notes, but Jesus didn't heal everybody in the village. He'd move on. No, we got to go down the road. Something to think about. And maybe there's a conversation or two that some of you might want to have when you go back. But don't tell them I told you that. This is Terry. Met Terry after his first year of med school at the University of Indiana. At the time, Terry was working in a underserved faith-based clinic in, I think, northern Indiana. Terry is now in family practice in Indianapolis. And let me see, 15-minute visits. Here's what I want you to see about Terry. Terry told me, he said, in this time constraint thing, he said, well, you know, Bob, he said, doing spiritual care actually saves me time. And I'm like, what? He said, no, it saves me time. I'm like, well, how does that work? And he said, when I start asking spiritual history questions, when I pray with my patients, when I talk to them about what's important in terms of their faith, he said they know that I care for them. And they trust me. And he said, when I give them instructions or a recommendation or a procedure, he said, they don't ask me near as many questions. He said, I am convinced when a patient is often asking me a lot of questions, they're really trying to figure out if I have their best interest at heart. And he said, when they know I care for them, they don't ask me as many questions. And he said, also, they don't push back on my recommendations as much. And he said, Bob, that saves me time. And again, the context is, Terry, how are you managing And he said, well, when I do spiritual care, it saves me time. Now, that's more of a truism, a principle, sort of like a proverb. And he also told me, he said at the end of a new visit, in addition to maybe a spiritual history question or two, he said, I will tell my patient, if there is ever anything going on in your life and you don't have anybody to talk to, I'm open. If you ever needed prayer, I am available. And he will conclude the visit with, is there anything that would be helpful today for me to pray for? And the other thing that Terry told me, he says, I think he said, if some of the spiritual care can be done quick, other thing he will do is he will maybe refer people to a church. He has thought through local churches in the area that are in alignment with what he would hope would happen and what they're offered. One of my friends years ago, when she first moved into her little mountain town in Arizona, she knew that she wanted to do spiritual care. And so she made appointments with several of the local pastors. And she went in and she told them who she was, how she was going to be practicing medicine, and that she anticipated there were going to be times when she needed to refer patients for pastoral care or church care or get involved in a church. And she wanted to know if this was something that they would like to be a part of, and if so, how many patients on a weekly basis or a monthly basis she might be able to refer to that individual pastor. She said some of the pastors looked at her and said, you do medicine, I do the spiritual thing, I'll take care of all that myself, Another pastor that she talked to got up from the back of his desk, and he said, you don't know this, but he said, we have been praying that a doctor like you would come to our town. And he got up and he went around and he gave her a big hug. Brand new doctor in town, in a group. The next Sunday, he gets up, and in his sermon, he said, there's a new doctor in town. She's a believer, and every one of you need to go home and in the morning call her office and make an appointment. And the first week, her schedule was full. And the seasoned attendings are like, who are you? What did you do? And that gets to the point. Sometimes you don't have to do it all. And you can have partnerships and you can refer. But understand, when it comes to spiritual care, you might be the only Christ follower that they see or they know, because normally they would never go to church. But you are intersecting their lives at points that they are maybe more open to spiritual truth than they might be at any other time during their adult lives. You have an incredible opportunity. And I've been involved in ministry. I've worked with some of the best in the history of the church. And if they knew what I knew about your world, they would be envious. And they might quit what they're doing and go back to med school or nursing school. Incredible opportunity. This is Todd, and Todd is about the same age as I am. He recently retired from full-time family practice. He was on our board of directors with Medical Strategic Network, involved in CREW as a student. He went into healthcare from the get-go because he wanted to live out his faith, and he saw it as a great place to do that. And here's what I want you to know about Todd, and maybe I should have started with this. But Todd told me when I talked to him about this, he said, Bob, it's never been harder. Never been harder because of the time issues. So that is not a concession. That is just an acknowledgement. If you're feeling the pressure, if you're feeling the tension, you're not alone. But hopefully you'll see And you've seen that this can be done. It is being done. Academic centers, private practice, #1 cancer center in the world. It's happening, and it's happening today. And it's happening in underserved FQHCs, private volunteer clinics. But intentionality, focus, priority. Some books that have been helpful to me. Gray Matter is written by David Levy, a neurosurgeon. Some of you might be familiar with this book. Subtitle of David's book is A Neurosurgeon Discovers the Power of Prayer, One Patient at a Time. And it's a story not only of his own spiritual journey, but his journey to beginning to do spiritual care in his own practice. A couple of friends of mine, Michael and Tracy Balboni, up in Boston. Tracy is on faculty at Harvard Med School. Palliative care oncology, I think, or pulmonary oncology is her specialty at Dana-Farber, and Brigham and whatever. Who's from Boston? Help me out. Yeah, here, thank you. So they've written a book entitled Hostility to Hospitality. And they examine what many of you are living with every day. In healthcare, you've got the patient care side, you've got the business side, you've got the legal side, you've got the insurance ethical side. And a lot of times those things are all working together in the same direction, but most of the time they're pulling apart in totally different. So navigating that and recognizing that. So a couple of resources. Now we talked about resources, we've talked about referring. A lot of times, you might not have time to deal with every spiritual issue, or you might not have time to share the gospel with every patient. These are some resources. I'd like you to pull out your phones right now. Pull out your phones, launch your browsers. All right, Safari, Chrome, whatever it is you use. See many of you writing down these websites. You can do that, but open your browser right now. First website I want you to go to, everyperson.com. Everyperson.com. Go there. Type it in, pull it up. You'll see a darker skinned guy smiling. You see that? Orange. You guys have it? Okay, I'm going to give you one. This is a website that was intentionally designed for people who are curious about God, searching about God, maybe skeptical about God. I'm going to give you 1 minute. Go anywhere you want to on this website.
So last year I heard this, and so I got a short that brings that up, and that's a clinical summary that prints it out, that I just printed out automatically.
Oh, really?
Yeah.
Okay. Wow.
Yeah.
Thank you. Okay, Ken, what'd you look at?
Looked at, I got through this article. It's peace of mind in an unstable world.
Wow, peace of mind in an unstable world. Do you have a patient feels like that? All right, where's my Mississippi State alum? What'd you look at?
Be amazed by the kindness of God.
Oh, okay, kindness of God. All right, how about you, ma'am? What'd you look at? Oh, like you guys need to talk. Get together afterwards. All right. How about you, sir?
6 straightforward reasons to conclude why God exists.
Wow. A little bit more philosophical. Reasons that God exists.
I'm a philosophy page.
Yeah, what else are you going to look at? All right, if you go to the home page and you scroll down, you will see that this website is instantly available with the click of a button in about 50 different languages. All right? This website was put together by Cru, Campus Crusade for Christ. The lady who is the lead on that team, when she was in her 20s, she was not a Christ follower, trying to figure out life, and she read about 20 different philosophers. You know what she found? What she said? She found all of them wanting. Didn't give her what she needed. A friend of hers said, well, why don't you read the Bible? And he's like, the Bible? It's like, well, you've read everything else. She started reading the Bible. She ended up becoming a Christ follower. So she understands how that mindset works. You might be thinking, well, Bob, I've never heard of this website. Well, I hadn't either until a few years ago. I'm on staff with Cru, and our statistics show that I haven't heard about 2025, but in 2024, 80 million people came to this website. And on average, our records show that 10,000 people daily found faith in Christ. This is an incredibly effective website. I've been doing some training for the last 2 years with a major FQHC, faith-based in LA. I live out in Redlands, California, about an hour drive, and I take the train in because I don't want to deal with traffic. And one day I was coming back from one of the clinics, and I'm on the train, and I sit down with this lady, and we start talking, and I find out that she is going to see her parents. I find out she's going about 4 stops down. I find out that her parents are ill. I find out that her parents are actually end stage of life. I find out that she goes out a couple of times a week and sort of is managing, overseeing their care. And I asked her, I said, has any of this been stressful for you? And she's like, yeah. And I said, what keeps you going? And she said, I don't know. And I said, are you from any type of faith background? And she said, no. And then she started asking me questions. When I asked her, are you from a faith background? And she said, no. She looked at me, she said, are you? And I said, yes. And she said, does it help? And I said, yes. And she said, how? And I shared 2 or 3 ways. And then I heard her say, maybe I need something like that. And then the conductor announced her stop, and the train started slowing down, or the MA knocking on the door. And I said, there's a lot of things I wish we could talk about, but we don't have time. I said, pull out your phone, launch your browser, type in everyperson.com, bookmark it. See, that's why you don't have to write it down, bookmark it. And she did. And she stood up, and she held up her phone, and she said, I'm going to look at this later today. And she got off. I've looked for her on the train since. I haven't seen her. Prayed for her a lot. But this is an incredible website. There's another one I have up here called everystudent.com. Tell you a secret, if you were to type that in, it's the exact same website, just a different URL. So if you got students, everystudent.com. Startingwithgod.com. Tremendous website made by the same people for people who are beginning their journey with God or maybe renewing their journey with God. HopeHasArrived.com is a website. HopeHasArrived.com is a website that is really for cancer patients. Different group of people, but similar vein. All right? Now, so I think that's about it. Before we open it up for Q&A, I've talked about our preceptorship several times. Students, We'd love to have you join us one summer. This summer, we got one spot left for a guy, and I'm looking for that guy. And it's a 4-week, this will be the 25th year that we've done it. We had students come from the best health science campuses in the world, join us. We have a relationship with the major med center, so we can take you into the med center, give you patient contact, interaction, develop your skills in whole person care. We have fun because we're in Southern California. It's about outcomes. Bruce, you met him earlier. He said the training that I got at the preceptorship shaped and changed how I practice medicine for my entire career. God often brings me patients more for the spiritual care than the physical, although he does medical really well. Students, I know, I got to do research. If I don't do research, well, we've had students attend the preceptorship and match into anesthesiology, neurosurgery, ophthalmology, dermatology, orthopedics, all that stuff. So check us out. I'm giving $50 for everybody that gives me a good evaluation. Questions that you guys have or comments? Yes.
So I'm thankful for this website because it gives many different languages.
Yes.
Because I pediatrics and Clarkson and SMA and we see just about probably 80% of my patients speak different languages.
Wow.
All of them are on this list. So I think it's helpful that you said at the beginning about just some soft tosses to the patient, about, questions to ask, because probably 75% of my patients are Muslim.
Okay.
So then I have that barrier, which can maybe not be a barrier, but I think I can ask them, well, tell me how important your faith is to you.
Yes.
Faith, and that can be helpful lead in to more deep conversation. I had a very significant conversation a few weeks ago thankfully the dad spoke English from Afghanistan, and about sin, and they believe very differently from us about sin.
Yes.
So it was just interesting to have that conversation.
Yeah, in that website, what crew has found is a lot of times people really appreciate opportunity to just consider and read on their own time, in privacy, anonymity, whatever. And on those websites, they can ask questions and they can reach out and eventually connect with a live person. So, other questions or comments? Yes.
I think I'm an outlier at this conference in that we are a free clinic, but we have over 340 volunteers.
Wow.
And they are part of our mission field.
Okay.
So I can't rely on every provider to go.
Of course.
So we try to have prayer volunteers at every single clinic.
Okay.
But one of the things that I have on my radar this calendar year is to work to try to bring in that spiritual training component when we front load with our volunteers.
Sure.
So I know I was excited to see that you work for Crew. One of my staffers just left Crew, so I'm going to be plugging her brain, but I would like to know, do you have any resources or materials for training for that population, not just necessarily the patients as well, because we're
Sure.
all of those people in our population.
Our organization hosts conferences. Our organization is available to actually come in and do in-service type things, and then there's a whole curriculum that's online. They don't have a booth this year, but the Neighborhood Christian Clinic in Phoenix, go to their website. They actually have curriculum online training for doing spiritual care. So those are a couple of resources. And CMDA has some things as well. So, yeah. Anybody else? Other questions? Yeah.
Yeah, thank you for your talk.
Sure.
Something I'm curious about is what spiritual care looks like beyond the walls of the and the time of the actual appointment. And what you shared about the oncologist really made me think about if you have any lessons about praying for patients before you even enter the room, after the visit. Like, what kind of lessons have you learned from your conversations with clinicians about spiritual care when you're not actually seeing the patient?
And this is like ongoing or afterwards or whatever?
Yeah, just any sort of like how do physicians or clinicians?
Well, I think like some of these resources can have ongoing effect. I think talking about and maybe developing a network of people that you can refer to could have potential, traction before going into the room. Yes, and actually the doctor that you mentioned, one of the things that he does and he's known for is before he enters every room, he will put his hand on the door and he will say a short 5-second prayer, just to sort of redirect him, center him, things like that. So yeah, Bill. Yeah. We are out of time. I will be here for a few minutes afterwards. I'd happy to talk or get together over coffee later today or tomorrow. Thank you for what you're doing. And if there's anything we can do to serve you, let me know. Students have flyers about our preceptorship. Look at our Instagram page as well. So thank you. Have a good afternoon.